Latest briefing from the South Korean health authorities. Let's listen in.
안녕하십니까. 보건복지부
Good evening.
홍보기획 담당관입니다. 지금부터
I am the
코로나 바이러스
supervisor
감염증
from
일부
the
중앙재난안전대책본부
Ministry
정례
of
브리핑을
Welfare and Healthcare, and
시작하겠습니다.
we will start the
오늘
regular
브리핑은
briefing for
손영래
today. Our
중앙사고수습본부
briefing today will be presented
전략기획관장이
by
진행합니다.
Mr.
보험 및
Sonyoung
통역사의
Nae
수호
from
통역을
Central
제공됩니다.
Disaster and
먼저
Safety
손영래
Countermeasures Headquarters. We will also be
전략기획관장이
providing
코로나19
sign language
대응 방안 등을
translation. First, we will
설명하겠습니다.
hear from Mr. Sonyoung Nae.
예, 9월 6일 일요일
It
정례
is
브리핑을
September
시작하겠습니다.
6th, and I'll
오늘
start the
0시
regular
기준
briefing for
국내
Sunday.
발생한 신규
As
환자는
of midnight of
152
today,
명입니다.
there were
어제 한
152
분이
additionally
돌아가셨고
confirmed community
현재까지
spread.
사망자는
Another
총
person
334명입니다.
passed away yesterday, and now there are 334
유가족의
cases of deaths. We pay our respect to the deceased and the family
국민들의
members.
거리두기 노력이 효과를
So we are
나타내며
seeing the effects
코로나19의
of social
전파는 계속
distancing
억제되고 있는
practiced by our
양상입니다.
citizens, and we are
지난
curbing
일요일부터
COVID-19.
토요일까지 한
From
주간의
Sunday
일
to
평균
Saturday
국내
for
발생
a
환자
week,
수는 약
on a daily average, we
218명이었습니다.
saw around
그 직전
218
한
newly
주간에
confirmed cases.
331명에
It
비해
used to be
3분의 2
331 on the
수준으로
previous
줄어들었습니다.
week, so this has been
수도권의
decreased to about a
경우에도
third.
일일 254명에서
And for the metropolitan city as well, we were able to see a decrease in the number of newly confirmed cases. And across the country, we are seeing a trend of a continuous decrease in the number of additional patients. And it is being maintained at around 100, so this is a positive. And social distancing effect shows up around a week or 2 weeks later. So our effect that we see now is thanks to the effects that we started in the middle of August. So we are seeing that this is the impact from those 2 cases that we practiced before. We want to thank our citizens and those living in the metropolitan area for your efforts. And this week as well, we have strengthened social distancing, and we're going to practice it for another week, so we hope that this effect will continue. And if we just try a little more, we believe that we'll be able to reduce the number of patients to a level that we can control. And the level 2 for social distancing across the country will be maintained for another week. And also, we will make sure that the strengthened measures on social distancing will be practiced for another week in the metropolitan area. And we believe that you must be tired, and we want to apologize for that. So let us remember all the hardships that we have so that we don't have to extend or lengthen the strengthened measure on social distancing afterwards. So we want to ask for you to strive hard once again. So we want to ask you to focus on social distancing, because if we do so, we believe that we'll be able to curb additional number of patients to a level that we can control. In a meeting that we held today, we talked about the measures that we should take during the Chuseok holiday. And Chuseok holiday, we expect a lot of citizens to make movement, and especially this will be similar to the level that we saw in May and August when we saw an outbreak of COVID-19. And when we consider that, we have to make sure that we strengthen the measures on disease control during the Chuseok holiday area. First, during the Chuseok holiday this time around, we ask you to refrain from visiting relatives or going back home. So we have to remember that we are still seeing cluster outbreak across many regions, and we are also seeing severely ill cases as well. And if we consider what we are seeing now, we believe that after Chuseok holiday and before Chuseok holiday, it will be difficult for us to completely control unknown cases. So we believe that in the Chuseok holiday, there could be a possibility of COVID-19 spreading through relatives and through long movements. So we ask you to stay at home for this Chuseok holiday. The government is also planning to strive hard. For the train tickets, we're only going to sell tickets in the window areas, and we're going to reduce the percentage, and we are making sure that masks are being worn in trains. And in the rest stops, we're going to reduce the number of crowdedness by having people only sit in single lines. And we are also going to come up with customized disease control measures for the Chuseok holiday, and we're going to make sure that our citizens are fully informed. We are also increasing the measures for be
가급적
visits
자제해
made
주시고
to
9월
graves and
20일부터
cemeteries. So we ask
이
you to
항을
refrain from visiting grave
장사정보
areas
시스템에서
or
제공하는 온라인
cemeteries.
정보 서비스를
And
이용해
if
주실
possible,
것을
please make
부탁드립니다.
use of the online
또한 봉안 시설에
visitation
방문하는
services.
경우에도 명절
And
전후
if you're
2주간
also
운영될
visiting
예정인
other areas,
시간대별
please
사전
make
예약제를
sure
이용하여
that
지나치게
you
많은
make
분들이
use of
한꺼번에
an advanced
밀집되는
reservation
경우를
system
피해
so
주시기
that we can
바랍니다.
refrain any cases of
봉안 시설은
crowdedness.
재래실과 유가족
So for
휴게실을
the
폐쇄하고
graveyards and
방문자
cemeteries, we're
동선을
going to
여러 갈래로
refrain from
분리하는 등
opening
방역
up
조치를
visitor
강화할
sites,
예정이며
and we're
이에
going
따른
to
불편이
also
클
increase
것이나
the
국민
measures for
여러분들의
other
양해를
disease
부탁드립니다.
control measures.
추석 기간
And we ask for your
감염성 위험이 높은
understanding.
사업장과
And
시설에
in
대한
business
방역
sites
관리도
and
강화할
facilities
예정입니다.
that may increase the
백화점과 마트
possibility of
등의
the spread
유통시설은
in the
직원과
Chuseok holiday,
고객 모두
we are
마스크를
also
착용하고
going to
고객이
strengthen
많이 모이는
preventive measures.
행사나
So for
시식,
department
시음을
stores and other
자제하도록
markets,
관련
we
업계와
ask
협의하고 있습니다.
everyone to wear masks, and we are also
전통시장에
controlling
대해서는
it so that
지자체와
we
중개청이
are refraining from
방역
people
점검만을
from
구성하여
having
주요
testing
전국
services.
전통시장
So
200여 곳의
for
방역
traditional
상황을
markets as
점검할
well, we're
예정입니다.
going to monitor
택배
around
유통 물류
200
업체에
sites.
대해서도
And for
사업장
logistics
방역 관리
and
실태를
shipping sites,
점검하고
we're
배송
going to
인력의
monitor
방역
the
관리를 지도할
status and we're
예정입니다.
going to inform them
특히
of
보잉
preventive measures.
요양시설과 의료기관은
In particular, for
원칙적으로
medical
추석 기간
facilities
중에
and long-term
면회를
care
자제하도록
facilities,
하되
we're going
부득이한
to
경우 사전
limit
예약제를 통해
visitation.
투명
And if it is
차단막이 설치된
inevitable,
공간에서
we are also going to
비접촉
have an
면회를
advanced
실시할
reservation
예정입니다.
system, and we're going to have some clear
추석
blinds
연휴 기간
installed
중에
so that people can
유흥시설이나
visit their
실내
relatives in an
다중이용
on-packed
시설에서
manner.
지나친 밀집과
And for
밀접
the
접촉을
entertainment
줄이기 위한
facilities,
대책도
we're
검토
going to
중에
also
있습니다.
come up with measures so
정부는
that we
9월
can limit any
30일부터
contact.
10월 4일까지
Starting
추석 연휴
from
기간을
September
방역 기간으로
30th
정하고
to October
전국에 대해
4th, we're going
사회적
to
거리두기
make
2단계의
this a
주는
special
방역 조치를
preventive
검토하기로
time
하였습니다.
period, and we're going to monitor
향후의
disease
환자
control
발생
for these
양상과
time periods
방역
as well.
상황을 감안하며
When we
클럽,
consider the
유흥주점 등의
situation that we had in
위험한
the
시설의
past and
운영
situations
중단
that we
등을
could
포함하여
have in the future,
상세한 내용을
we're
검토하여
going
조만간
to
발표하겠습니다.
monitor and review additional
또한
measures
연휴
and make an
기간에도
announcement
방역과 의료 대응
in the near
체계는
term.
빈틈없이 운영되도록
And we are
만전을
also going to make
다하겠습니다.
sure that some
해외 유입
facilities
차단을 위한
are
특별히
operated in a
국정차,
seamless manner.
별도 운송은
We're going to
계속될
have a
것이며
special entry
공항과
measure
항만의
for
검역
people coming in
체계는
from
3교대로
overseas,
상시
and we're
가동하여
also going to
빈틈없는
have 3
검역이
shifts
이루어지도록
for
하겠습니다.
any people coming in through
연휴
ports, and
기간에도
we're going to make sure that this is
진단검사를
done in
받을
a
수 있도록
seamless manner.
이용 가능한
And we're also
선별진료소의
going
정보를
to
안내하는
make
한편
sure that we inform
영상과
people of
생활치료센터도
these
충분히
screening
확보하고
centers that are
응급실 등
available so that
비상진료 체계도
people can be
차질 없이
tested even
운영하겠습니다.
during holiday periods.
우리
And we're
민족의
also going to make sure that we have a
추석에
systematic
대하여
measure for the hospital beds
이동자재를
as well.
권고하는 것이
So
많은
for the
분들에게
safety of
아쉽고
our
안타까운
citizens,
일이 될
we
것임을
are
잘
recommending
알고
people
있고
to
정부도
limit
매우
movement in
부담스럽습니다.
the Chuseok holiday.
그러나
And we
이번
apologize
추석은
for this
나와
because we
우리
believe that you are
가족과
sacrificing
신지의
yourself.
안전을 위하여
However,
집에서
during this
지내는
Chuseok
것을
holiday,
꼭
we want to
고려해
ask
주시기
you to
바랍니다.
stay at home for the
특히
safety of
코로나19의
yourselves,
치명률이
your
높게
family, and
나타나는
your relatives.
어르신 등의
In
고위험
particular,
분이 있는 가정은
for
이러한
those with
조치가 꼭 필요하다는
elderly
점을 유념해
members
주시기
and
바랍니다.
your family members, please make sure
거리는
to remember
멀어도
this
화상
because they
통화나
are in a
선물,
higher
편지
risk.
등의
So even
비대면
if you
형사를 통해
are far
서로
away,
간의
please
마음을
make
나누는
sure
방법을
to share your
적극적으로
hearts
선택해
through
주시기 바라며
online
정부도
services
이렇게
in an
마음을
on-tag
나누는
manner.
기회가
And
늘어나도록
we hope
다양한
that
지원 방법을
we will also
모색하겠습니다.
provide support so that you can do it.
마지막으로
And
의대생의
lastly,
국가 실기
For
시험에 대해
the
안내해
medical
드리겠습니다.
students, I will inform you
의사단체의
about
the
the practical tests that you'll be taking. So based on the cooperation and agreement that we made, for the medical students, they can actually apply for the test until tonight, and we have extended the time period. And some of the associations in the medical sectors have said that there is a shortage in the time period, and there is a physical limitation. So for this week and for next week, for those who have reapplied, we are going to make sure that they can actually take the test after November. So we have prepared that. So you have to remember that you have to apply for the test so that you can actually take the test by the end of this year. So we want to ask you to finish your application by tonight. Over the past week, We had to face hardships where we saw a stop in our daily lives. However, our citizens cooperated, and we really want to thank you for that. So the results and the fruits of your efforts are showing up now. So if you just make a little bit more efforts, we believe that we'll be able to reap good results. So we want to ask you once again, just for another week, please refrain from going outside or having outings and stay at home and focus on social distancing measures. If we were to cooperate just for one more week, we believe that we'll be able to limit any additional harms that are provided to others. So let us think of all of ourselves and make more efforts. Thank you.
네, 지금부터 질의응답 시간을 가지겠습니다. 브리핑은 사회적
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.
Due to COVID-19, blood supplies have plunged as people choose to keep a distance from others or hesitate to donate blood due to possible infection.